Well, my name is Stephanie Lorette, and I will be guiding us through the presentation today. Build Right and CTA Solutions have teamed up to provide healthcare practices with important details that will help you protect your businesses during this unprecedented time. We continue to receive new information daily, and understanding that it's not only difficult to navigate the daily updates, but to also unpack the details, we wanted to provide you with some valuable information on these updates. Today, you will hear from two speakers with an overview of how your practice may be affected by this pandemic and some strategies to help combat these challenges. Over the next several weeks, additionally, we'll be partnering with other industry leaders to help guide your practice through a series of webinars with up-to-date guidance. This webinar will last approximately 1 hour, with speakers talking for about 45 minutes, leaving about 15 minutes for your questions at the end. Please feel free to submit your questions through the chat throughout the presentation, and we'll address them at the end during the Q&A session. You'll receive a recorded copy of this webinar as well as a copy of the PowerPoint in your email after the webinar. At this time, I'd like to introduce our two speakers. Dalia Cantor is a certified public accountant and certified valuation analyst. She is the founder and leader of CPA Solutions. Ms. Cantor has been practicing as an accountant, business consultant, and a tax advisor for over 20 years. She's retained by businesses, law firms, financial institutions, and individuals to provide services in diverse areas of business accounting, consulting, taxation, business valuations, and forensic accounting. Prior to establishing her own practice, she worked in public accounting, managing both domestic and foreign audit and tax clients. In private industry, she was involved in regulatory environment, specializing in technical accounting, internal controls, SEC reporting, and M&A transactions for publicly held international companies. Additionally, joining us today is Marianne Hennon. Marianne is the COO of Build Right and has led client relations department at Build Right for 7 years. She also oversees the revenue cycle management operations and compliance. She is a certified compliance officer, and her expertise are in clinical and billing process design and improvements, as well as compliance education for clients. She works in harmony with Build Right's India leadership team and coding managers to lead a seamless RCM operation for Build Right and continue to provide expert knowledge to improve our partners' clinical and RCM operations. Without further ado, we're going to move directly into the presentation, where Marianne will be talking to us about several key points, including telehealth, what it is and what are the different types, and what are some of the guidelines and latest updates. Billing and coding, the 1135 waiver, what it is and how it's changed workflow, and what's the pertinent information you need to know. And how do you communicate with your patients during this time? What is telehealth and what platform should you be using? And lastly, she'll be addressing advanced payment options, where and how to apply this with a step-by-step guide. Marianne?
Thank you so much, Stephanie, for the introduction. Hello, everyone. Thank you for joining our webinar. Basically, these are the key points I'll be covering today, and hopefully we'll be addressing a lot of the questions you all have been asking us, and I will end with the advanced payment options. So hopefully, before you walk out of the webinar today, you'll have all your questions answered. So before I kind of dive deep into these key points, I want to basically ask you a question. Do you have a plan or not? As you know, in Florida here, for those of you who are in Florida, during hurricane season, we're preparing for the hurricane. 3 days, you're going to be at home. You won't be able to go anywhere. Make sure you have enough food. And what we are experiencing right now with the COVID-19 is a little bit different. It's a more prolonged time. We have to prepare ourselves for a much longer period than, a hurricane. So I wanted to ask you if you have a plan for your patients. Are they prepared for this? Are your staff prepared for this? And are you prepared for it? So before we talk about all the details, we want to make sure that you have a disaster plan in place, and you are reviewing it constantly with your staff and management, so everybody knows what to do in time of crisis. Just like we at Build Right, we have shared our disaster plan and functional status updates with you guys early on, about 3 weeks ago. We have been fully prepared for this operationally, and the telecommuting, just how I explained it. So I think having a documented plan definitely helped, and following the what ifs, what if this happens, what do you do? And that way everybody in your company is basically aware of what to do when things do get worse. So definitely have a prepared plan, just like we always advocate for standard operating procedures. We highly recommend one for this COVID-19 if you don't have it already. And there are so many resources out there on CDC for clinical practices. And if you don't know where to begin, please feel free to ask us at Build Right. We will be glad to help you. But the goal is for you to know what to do in the case of anyone falls ill in your practice, or you are having to shut down. Although you're essential, but in case somebody's ill, what do you do in those situations? So mainly you have to make sure you set up your employees to work remotely in case someone is ill. Some people are experiencing mild symptoms, but in the meantime, they can still kind of help you operate your practice. So what do you do in that case? Don't wait until things get really bad for you to say, okay, let's get your laptop all set up, let's get you access. Make sure you start this process early on and reach out to your IT. And we are also, glad to help if you need anything on the billing side. So make sure you start that today if you have not already. And communication is key during this time. So make sure not only are you preparing yourself and your staff, but also communicate with your patients on what needs to be done and when, whether when they're symptomatic, and all the options about telehealth, which I'll talk about later. And going back to what I said about having a lot of resources available, the CDC is an excellent guide, and most of what I'm going to share with you today is from the CDC or the AMA. All of them are reliable sources, and I just love this slide here, and I did put a link here on Get Your Practice Ready. It's a full plan for your practice, and it includes forms you can post outside your doors, inside the clinic, and it actually has a clinical decision algorithm created by the CDC to guide you and your staff on what to do if you get that call that your patient is ill, and it even has the coding integrated in it. So definitely visit this link. I will provide, we will provide you a copy of this PowerPoint, so make sure you visit this website whenever you have time. So now going back to our main key points here, with telehealth, I want to start out by, a small disclaimer that if you are, I know many of you may be from different states, ensure that you're providing services in accordance with your state laws and regulations, because some of them may differ from what CMS is publishing. So make sure you keep an eye on those state regulations by visiting your state and local websites. And I will have some links also at the end under the resource slide to guide you on where to get those information. So as part of the emergency declaration, many governors may have relaxed some laws and related to the provision of telemedicine services. And for up to the minute, make sure you are keeping an eye on those updates, because sometimes they're every other day. And we are doing our best in making sure we are sharing those updates with you as we have it. So as we all know, CMS has expanded access to telemedicine services for all Medicare beneficiaries, not just those with the COVID-19, but also in addition to regular visits for Medicare beneficiaries. And they will now make payments for telehealth services furnished in any healthcare facility and in the home of the patient. Basically, patient can be home, and non-HIPAA compliant technology is allowed. Again, don't take that literal. There are recommendations of some apps that are better than others. So make sure you are utilizing those and not just taking that it's non-compliant, I can do whatever I want. You still want to be compliant during this time, just to avoid any more work you have to do. And Medicare is also allowing practices to waive cost sharing, like copays and deductibles, for all telehealth services. And some prior authorization activities are also being paused at this time. And again, this depends on payer by payer comparisons, to make sure you reach out to your billing team. We are also sharing this information for our BillDrive clients, and make sure you keep an eye on state and payer guidelines, because they may be different. So now going back to telehealth, there has been confusion, of course, with all the updates that are coming out on what is really telehealth. And by definition, I wanted to include that here. It's the synchronous telemedicine service rendered via a real-time interactive audio and video telecommunication system. So the video here is the key. And a lot of our clients are asking every day, what's the difference between video and just a phone call, and how do the codes differ? They are two separate things. And telehealth has been around for many years. I know it peaked in 2017. So it has been around. It just right now, all of the regulations and restrictions has been lifted thanks to the 1135 waiver. And that was March 17th. Basically, the federal government waived a lot of restrictions and relaxed a lot of guidelines. And the key is to offer care for patients. So they're not really going to be nitpicking and asking you, what platform are you using for telehealth, or how are you installing it? Is it secure? And what code are you using? What place of service? They're actually relaxing a lot of that to give you all of the attention to focus on your patients. So a lot of the answers you may see out there is take care of your patient. Coding, billing aside, of course, keep yourself informed, but at the same time, every day, the trend we're seeing is that a lot more regulations are being lifted. And the key goal is to take care of as many patients as possible in every single setting, okay? So basically, all of the E&M and other services that are currently eligible under the Medicare telehealth reimbursement policies are included under that waiver. And there is a very exhaustive list of CPT codes that is being published by CMS. And the latest update on March 30th actually added more CPT codes you can now do via telehealth. So I included a link right here for you to visit, and know that it most likely includes most of the codes that you are already doing. And this is a perfect place to check regularly on what other procedures are being added, what type of healthcare professional is able to do this care in what setting. Most likely it's from home. The patient can be in their home, and then you can render that service to them. The new update that came out, and again, this is a little bit high level. Originally, they had mentioned to add POS 02 for Medicare claims, and now they're saying add modifier 95 to describe the services provided via telehealth. And that code basically ensures that you are getting paid what you were to get paid if the service was rendered in person. So that was a big change. We had said POS 2, now it's, just kidding. It's modifier 95 with POS 11. So a lot of those updates, when we hear about it, we will let you know. And as your billing team, we will make sure to, assist you in any case. I added a link here, the AMA coding guidance, and it actually has scenario-based cases for you to review. If this were to happen, what would I bill? It's a great guide, so I definitely encourage you guys to review it today. Okay, so in the next 3 slides, I'm going to include some of the codes that fall under the virtual medicine, and that is in combination with the E&M codes that you may be already using. And E&M is evaluation and management, which includes 99212 all the way to 99215. So this is in addition to those codes. These are the codes that you basically can use at this time during the pandemic. So the telephone evaluation and management, that is a very commonly asked question to our billers and coders. And basically, this is inclusive of the ones that you can do if video is not an option. And a lot of patients may be elderly, and they may not have the technology handy, like a camera. So in this case, the telephone evaluation will suffice. And on March 30th, the CMS finalized the payment for telephone evaluation and management, and the codes are 99441 to 99443, depending on how many minutes you're spending, 5 minutes all the way to 30. And those are effective March 1st, 2020. And these codes are active and payable by Medicare, which they were not before. So CMS is allowing physicians now to provide these to new and established. So again, they're relaxing the rules more. Instead of saying established, now it's new and established. And the description of it is basically the telephone is provided to a patient, parent, or guardian, and it does not originate from a related E&M service. So if it falls in within, if you had a call yesterday and then you want to bill out this code today, you shouldn't. It's going to fall within 7 days. So make sure it's not within those time periods. And if you have specific questions regarding that global period of 7 days, definitely reach out to us and we will clarify. And again, you are basing this coding or whatever you choose based on the time you're spending. And just like any other visit, make sure you document and document and document. Document what you are doing during the call, who you're speaking with. That way, not only are you compliant, but if you need us to help you review as your billing team, we can assist you with that. And physicians can reduce or waive the cost sharing for these services. Another type is the Medicare virtual check-in and the G2012. And that basically enables a quick visit with a patient to determine if an in-person visit is necessary. So effective March 1st, these services are now, again, provided to new and established patients. And they're brief, 5 to 10 minute conversations with a physician. And then the communication can sometimes be done over video as well. So it could be, either or, but it's a very brief conversation. And the goal is, do I need a visit? Do I need to be seen? Or do I need to seek other help medically? And the physician, it can be constructed through multiple communication technology modalities, and that could be telephone, asynchronous telephone conversation, or exchange through video or image. Those are the two options. And then the clinician may respond to the patient by telephone, audio, video, secure, text message, keyword is secure, email, or patient portal. Make sure all those methods are secure and you are not sharing PHI where you shouldn't. And these are initiated by the patient, and that's the key difference here. Patient is reaching out to you, and the patient must provide, of course, just like telemedicine or telehealth, verbal consent. And the consent could be obtained before or at the service. And I'll cover in a little bit documentation on that consent. Physicians, again, the second type that you can waive cost sharing. And it can be used when a captured video or image is sent to the physician. So it's not live, it's actually taken, but then it's sent to the physician to review. Okay, so that's the other type you can do. And then also the Medicare e-visits or online digital evaluation and service. Again, it's a non-face-to-face patient-initiated communication through an online platform like the patient portal. And that's the same effective date, March 1st, 2020. They can be provided to new and established patients, and consent has to be given, and you can waive the cost for these, the cost sharing for these services. The codes span from 99421 to 99423, and again, depending on the time that you are spending with your patient. Now, documentation, we did get a lot of questions on documentation during this time. Is that relaxed? So basically, it's same as those documenting in person. So make sure you are continuing to have your EHR open while you're doing telehealth. Document as you would if it were a regular face-to-face visit. And basically what the big change is now E&M levels can be based on medical decision-making or the time associated with the encounter. So those two are what's going to determine the E&M level you're going to choose. And a lot of you asked us, how do I do a physical exam, over a video? And again, you can direct the patient on things, does your throat hurt, and ask them questions. But if you can't, most of the levels can be chosen on the medical decision making, or how long the visit was, how complex, what's the complexity involved in the visit and the patient symptoms. The proof of time must be documented and time-based, so make sure you document, this much time was spent with the patient discussing the following, and make sure it's detailed. And CMS is allowing you to do so during the pandemic. So I know a lot in the past, documentation has been always a problem. Right now they're relaxing a little bit, but still you should document what happened in the visit, even for future, post-pandemic follow-ups. You have to notate the consult or visit was held via telemedicine, first line in your note. Notate patient location and referring physician, for example. So it would say this office visit was completed via telemedicine assessment. The patient gave full consent to perform the telemedicine visit. And of course, you're asking the patient before you write that, are you giving me full consent to do the visit over video? And the patient says yes, and then you go ahead and document that. And then name people present during the call. If you have someone in the room, like a scribe, or if you're still in the clinic and your patient's at home, make sure you notate who is in the room with you. But recommended, it needs to be a private location. So next point here is communication is absolute key during this time, just like our government is doing, even local authorities twice, 3 times a day, sometimes we're getting updates. So same with you. You have to make sure communication is fluid in your practice. And know that you are the biggest, you as in the physician, you are the biggest advocate for this transition. And don't feel like this is the end of the world and my operation is literally gonna stop because I'm switching to, telehealth in this case. It's not. You can continue the same way, have the same count. You just need to communicate with your patients on what they need to do. So educate your patients, and there are options available, to suit each patient. Video, there is audio, there is portal, there is online check-in. So it's not just one option. And a lot of you may be seeing for patients across all ages, and the key is to let them know there are options available to you, and here they are. Now, how are you going to communicate that? A lot of you may have marketing teams working for you. Some of you are just on your own, and basically use your website, add a link. I've seen some put a link to their telemedicine check-in on their website. So if your patient wants to see you, they click on it and they go into the waiting room right away. Send out a mass email to every single patient you have, letting them know we are now offering telemedicine. I'm getting it from my own primary doctors, and it's a great thing to know that they are still available for me. Text messages, if you have a platform available, do a blast of text message for all your patients, letting them know what to do, what's available, what your hours are. Some practices are extending their hours right now, just to make sure they're taking care of sick patients. Social media, Facebook, LinkedIn, make sure you add the same information on there. Some of your patients may be visiting you on social media more than your website. So definitely post there as well, and give them instructions, and make sure you're letting them know it's a 1, 2, 3, or a link. You click on it and you're able to see your provider. Don't complicate it. Don't use something that's going to require 10 steps, because this is a time where patients need to know you're available and they can access you easily. Again, patient portal for those who like to visit their portal. Flyers in your practice for those who are still coming to the office, or someone passing by. You should definitely post these on the inside and let them know, you offer telemedicine. And please make sure, this is the biggest point here where we're hearing patients just don't want to do the appointment, is it's complicated. I don't know what app you're using or platform you're using. Make sure you test it yourself, with one of your staff members, and you just pretend you're the patient, click the link, see how many clicks are involved, put yourself in the patient's shoe if they're not feeling well, and on top of it, they have to deal with technology. So make sure that you know exactly how many steps are involved. So when your patient says, this opened up, or I had to download this, then you know exactly where they are. Doxy.me is an example of a simple to use app. I'm hearing good feedback about it. It requires you, there's a free version and a paid version, so definitely go on there and explore. But you are able to use, during this time, during the pandemic, WhatsApp, FaceTime, Google Hangouts, any platform that is not public facing. Public facing meaning TikTok, Instagram. It has to be just a one-on-one platform. But again, use the ones that are preferred. I know some are using Zoom Healthcare, Doxy.me, or use the one that's integrated with your EHR. If that does not involve 100 steps or a long time, you can maybe start with something that's simple to install while you implement the one that's integrated with your EHR. That way you have it for the future, because we don't know how long this is going to be. And again, lastly, recognize your limit. Don't just start blasting emails about telehealth and not have your schedule organized. Make sure you're able to know in your practice, what is the MD going to be able to, how many patients am I going to be able to see? How about my nurse practitioner? So that way you know exactly how to handle the load if it were to increase, if this pandemic does get worse. And then how you manage that process from A to Z needs to be designated to someone in your practice, so they are kind of the champion of it. So if anything happens, regarding telehealth or technical issues, or patients are having questions, you direct them to that one person in your practice, so that you can have kind of the same answer across the board for everybody. I have one more slide coming, but before I share it, I'm going to switch gears a little bit. I want you to know that there are so many resources out there available to you. Again, there's light at the end of the tunnel. You're hearing a lot on any other webinars you may be joining that this is unprecedented and it's sad and it's exhausting, but at the same time, we're seeing things that have never happened in our healthcare industry. So definitely take advantage of it. And make sure that you're utilizing those resources wisely. So I'm going to kind of fly through the last slide, because it was again, frequently asked question by some of you, which is the advanced payment option by CMS. And that was enacted on March 28th, 2020. The Trump administration came out with it. And the goal is, again, to give you assistance and help you. And most providers under Medicare Part A and B can now request 100% of their Medicare payment in advance. So it's not an increase, it's just an advance payment. And then it's going to be basically an automated recoupment process later. The form of the advance payment option can be found on your Medicare Administrative Contractor, or MAC, website, and it can be submitted online. They made the process very easy. After your request is received, the payment is expected within 7 calendar days from the date of request. Now, we don't know if CMS is backlogged at this point, but many of you have already applied and you're waiting to hear. Note that the email on that form is most likely going to be your email, so make sure you're checking your email and seeing if CMS gave you any update on it. To be eligible, you must have billed Medicare. Obviously, you have to be a Medicare provider for claims within 180 days prior to the date of the signature on the request. And you cannot be in bankruptcy. You cannot be under any medical review or integrity investigation by CMS. And you may not have any outstanding delinquent Medicare overpayment. The amount of payment you're going to get, most resources in CMS point that it's an average of a 3 months payment. So if you get $50,000 in 1 month, you would get $150,000. So it's a 3 months payment average. They get to determine that and cross-verify it with their records. But for Florida clients, I know this is based on MAC. So I've seen the first codes for Florida. It asks you to check a box that says, please, provide me the maximum calculated amount by CMS. And some forms, like Connecticut, is asking you for an exact amount. So in that case, just give them an average, ask your billing team, and again, they will cross-verify that with their record and then remit the payment to you. Most important question is repayment. So repayment begins 120 days after the date of issuance of the payment. Okay, so 120 days after, that's when the recoupment process starts. And basically, during that time, you continue to receive regular payments on any claim you're submitting. But then after that, you start to see recoupment from each claim, one at a time, until the full amount is recouped. And it will be recouped over a period of 210 days. A lot of you asked that question. So how long do I have to repay it? You don't have to do anything. It's 100% automated process, and it takes 210 days. I have the fact sheet included on the slide if you want a step-by-step guide, and we at BuildRight actually created an SOP or a step-by-step guide for if anybody needs it or if you need help, please reach out to us and we will share that with you. So again, just to conclude on my end, this is just an advanced loan, no interest. It's quick to obtain, and I highly recommend you guys take advantage of it. If you don't need it now, get it and just put it in your bank account, save it for the future. And on that topic now, I'm going to be switching to Delia in a bit, but I did want to mention all the resources I have for you here. These are all up to date. I've checked them all, so make sure you check these out. Okay.
Thank you, Marianne. That's a lot of great information. As we mentioned earlier, if you have questions, please submit them in the question and answer down below, and we'll answer them at the end. Again, you'll get a copy of this recording to your email to answer any additional questions, or if you have specific questions that aren't addressed today. But now I'd like to introduce you to Dalia Cantor, CPA, CBA, who will be talking about some key points, talking about managing your overhead, talking about financial assistance available and how do you get it? What's the differences between the different types of loans available out there? What about your current debt obligations, and what about financial accountability? So without further ado, Dalia.
Thank you, Stephanie. Welcome, everybody. Thank you for joining us today. And Marianne, thank you very much for, for a great presentation. And now that everybody can still bill on telehealth and receive excuse me, money, now let's talk about cost and some options that you may have for really managing the finances, managing your overhead. I want to start with making some points about managing your overhead before you go to get financial assistance or any loans that are out there, or even before you get the Medicare Advance program. Marianne, if you don't mind sliding down one. So managing your overhead, I put a couple of key points that I think are important for you to look at. Because things changed rapidly and you need to review your cost on a daily basis. So first thing I would suggest is review in detail your current monthly expenses. See what you can save, see where you can cut a little bit or postpone for until things get better. Number one item, I would look at non-essential business expenses, and you can either suspend them or reduce them at a minimum, such as club and association dues, auto and travel allowances. Since there's no travel, there shouldn't be no allowances for employees. Any printing and promotional expenses. And I don't mean necessarily marketing or advertising, but rather your promotional materials, your client referral, patient gifts. These are really not essential business expenses that could reduce your overhead. Also look at aligning your ordering of your clinical and lab supplies with your current billing. Sometimes your back-end staff will continue with the same pattern, even though your revenue has dropped. So you may want to take a closer look at the ordering process of your supplies. If you had to lay employees off, review items for which you pay per seat fee, which include licensing fees, EMR subscriptions. Also review your phone lines. If your if you perhaps utilizing too many lines, you may be able to save some cost. EMR subscription is a lot of your other software is on a contract. However, licensing fees per person per seat typically can be reduced or increased based on your needs. So that doesn't mean that if you're in a contract, you cannot change that. Discuss your insurance coverage with your broker. Malpractice, workers' comp, business interruption. Business interruption insurance has been one of the topics in regards to COVID, whether the insurance companies are giving you any kind of reimbursement for business interruption. I've been hearing that it's very, very difficult. The considering pandemic is not being as one of the items that are applicable to receive insurance benefits. Workers' comp, if you furlough or lay your people off, that may reduce your workers' comp insurance as well. If your revenue is less, you might be able to reduce your malpractice, or if you work less hours. Malpractice also can differ, and I don't know the answer to it, but you may want to check with your broker, because it might be that the telehealth versus in-office visit may have a different insurance premiums on it. And also review terms with your major vendors. If you have injectables or any shots or clinical supplies from especially from the major vendors like McKesson and Henry Schein, they might be able to extend your terms if that's what you need. I think everybody understands the situation, and everybody's kind of stuck. It's like, you have rent, but if you can't pay your landlord, they're not going to be able to do much about it. So this is part of overhead, and then once you have your expenses kind of tighten up a little bit, then we're looking, which already many of you have looked at, what is the financial assistance that we have available. And I'm just gonna wait for, there you go. Thank you, Marianne. There's quite a few. There's two major programs that I believe every one of you is already familiar with. I'm going to touch real fast about Florida Small Business Emergency Bridge Loan. It's available for, not many of my clients have utilized this, very few. It's only up to $50,000, but you can apply for this 1-year interest-free loan with the state of Florida. It's not a grant. You're going to have to repay this back, but it might be an option if you need a quick cash turnaround. The next big loan that came out with the stimulus package, or it's not really stimulus, the rescue package, is the SBA Economic Injury Disaster Loan, the EIDL. Again, I think many of you, at least my clients, looked at it fairly closely. Eligible businesses can apply for working capital loan up to $2 million. The interest rate for this loan is 3.75% and repayment term up to 30 years. The SBA is deferring payments for the first year, and interest does not accrue. Applicants can also request advance of up to $10,000, and this advance is a grant. It doesn't have to be repaid, but if you're getting a PPP loan, which is a payroll protection program, that $10,000 will be deducted from the PPP loan. There was a lot of talk about SBA removing all the personal guarantee and collateral for these loans. However, the EIDL, there is no personal guarantee or collateral up to $200,000. But if your loan is larger than that, you will still need a personal guarantee and collateral. This loan is good for working capital needs other than your payroll expenses, your rent. So it might be an option for some, not all, obviously. There's also an SBA Express Bridge Loan, which is designed for businesses that are really struggling with cash to obtain a quick cash influx of up to $25,000 through an SBA Express lender. And this is really a bridge until you get the full EIDL loan. The next I want to talk about is the Payroll Protection Program, which is the largest undertaking that passed, and there's still so much guidance that's been changing every hour on the hour. And Marianne, if you don't mind flipping through the next slide. Thank you. So the CARES Act, which is Paycheck Protection Program, is designed for businesses with employees. I get questions that, what if I only have independent contractors? No, that only applies to employees on that are paid on W-2. So the maximum loan amount is 2.5 times average monthly payroll cost, which includes salaries and wages, health insurance benefits, and retirement benefits. I didn't put it here, but it's also your state taxes. So your state unemployment insurance payments would also come into equation. The annual compensation amount per employee is capped at $100,000 a year. So there's obviously a worksheet that adjusts for those typically owners and practitioners that get paid over $100,000. This loan will be forgiven if at least 75% of employees are retained. The funds must be used during an 8-week period after receipt for specific business expenses, payroll, rent, utilities, or mortgage or debt interest. There's been a lot of talk and questions. When does the 8 weeks start? The 8 weeks start from the day of you receiving the loan. There were also questions whether if the bank gets the funds, can you defer and hold them, or is it considered as a constructive receipt of the loan? So far, what I've heard and what I learned from other resources is that once the bank gets the funding, you basically, your 8 weeks start ticking then. And because the funds really get directly deposited into a bank account. So if your practice is closed because of COVID-19, and let's say you get the funding on April 15th, but you can't open until May 8th, your time starts at April 15th. That is as of right now. They may change that regulation, but this is how it is written and interpreted at this time. Repayment terms at 2 years at 0.98% interest for the portion that is not forgiven. Of course, we're trying to, when we apply for our clients, we try to maximize the loan amount. And once you get the loan, we will manage it to make sure that all of it is forgiven. And that's how it should be, because that's the way it was designed. If you had furlough your employees due to closure, as long as you hire them by June 30th, you're still eligible for forgiveness. Applications are processed through approved SBA lender, which in most cases is going to be your bank. This loan is first come, first served basis. So as everybody's talking, the money will run out. They're also talking about passing additional funds available. We don't know yet. The big thing about this forgiveness amount is actually going to be no income tax due from the forgiven amount, which is huge. So if you think about if the business is getting $200,000 in loan and it's forgiven, there's no income tax ramifications on it. So that's a real unheard of bonus point from our friends at the IRS. Some considerations when applying for SBA loans, we suggest clients to take a little bit more holistic approach when deciding which loans you should apply for. The PPP is obviously we advise every client to apply, every business to apply. But especially when it comes to idle loan, you need to look at your current financing facilities, because you may have some covenants that might preclude you from obtaining additional financing and indebtedness. So I strongly suggest you discuss with your banker if that would have any negative or adverse impact on your current financing facilities. Another question also we have a lot, can I apply for both PPP and idle loans? Yes, you can, but you cannot use them for the same purposes. So if you're applying for PPP to retain your employees and pay your rent and utilities, you cannot apply for idle for the same purpose, but you can apply for idle if you need working capital needs, such as, again, clinical supplies or any other expenses of the business. Have a clear picture of your overall operating cash needs. Kind of going back to reviewing your monthly overhead. What I also encourage clients is to do the end of the year cash flow projection. taking into account if you have lost revenue, when this revenue is going to come back up, and just kind of having a little bit better sight to your cash flow needs, not just till next week, but also towards the end of the year, which will help you plan a little bit better, understand what kind of capital you may need. Again, that's, the cash flow projection will give you a good indication whether PPP loan will be enough or will you need additional capital to sustain your business. And I'm always, I like to be debt free. I like my clients to be debt free. So I would lean on your suppliers for extended terms or a little bit more advantageous terms before you consider to take on additional debt. Calculating a maximum PPP loan amount, the measurement period is fiscal 2019, which is the payroll cost for tax year 2019. But you can also use rolling last 12 months if necessary. The reason I'm saying that is that some of the clients, let's say you had your employees in 2019, but 3 employees already left or they were laid off that had nothing to do with COVID-19, you have to take that into account, because the forgiveness is going to be based on what was your payroll in 2019, how much you got the loan, and what is your payroll now. So if there's some employees that retired or left on their own, this is going to come into equation. Choosing the lender, your current bank should be your first choice. We all heard about Wells Fargo fiasco. So if you have your first choice, but it's not available anymore, you need to come up with a solution, which we've been working with clients quite a bit to find out what are the alternatives. Most likely you will not be able to apply through different bank if you don't have banking relationship, because everybody just overwhelmed with requests and applications. Non-bank lenders might be an alternative solution if that is your last resort. And again, not all the banks even have opened the application platform as at this point, the portal. Thank you, Marianne. And the last slide I want to talk about is the financial accountability. So this is going to be very, just from the beginning of submitting the documentation, what you need, this is going to be a very closely looked after process. So all the financial assistance applications require submission of various financial reports. And we suggest you lean on your CPA for the most part, because typically we have the mass majority of the records that clients need. So I listed some of them just for your own knowledge, or if you're applying on your own. 2019 quarterly and annual federal payroll tax returns, which are forms 941 and 940. Forms W-2s and W-3. W-3 is just a summary of all your wages paid, summary of W-2s. 2019 and year to date through February 15 payroll registers. This is, so far we applied through, I believe, 6 banks. Everybody asked for year to date payroll register as well. So you want to make sure you have that available. 2019 business tax return or financial statement. You can't submit 2018 return because the application will be incomplete. They need 2019. If you have not done your tax return, that's okay, but you need to at least submit financial statements. And then there's a loan calculation worksheet where you calculate your estimated maximum loan amount that needs to be submitted with the application. And that is, as I mentioned before, based on 2.5 times your average monthly payroll cost. Some banks require additional documentation, such as bank statements. I've seen some banks asking for bank statements to back up your payroll register, so basically each paycheck. The banks that are running this, they have their own criteria. So even though it's an SBA loan, the banks are still responsible for verifying your eligibility for the loan. For PPP loan, to be forgiven, you need to prove the usage of funds. So in this case, it's not if, but when you get audited, because this loan will not get forgiven unless you submit the required documentation and you prove that you spend the money on the applicable costs that were related to the forgiveness, which are payroll cost, rent, utilities, and some debt interest. I suggest strongly to open a new bank account once you get a loan, and then keep that bank account strictly for those allowable business expenses. So you can change your payroll bank account to that new one until the money runs out. You pay the rent out of it. This way you have a very clean audit trail. Once you start commingling with your general operating, it's going to become very, very difficult and more costly for you, especially if you're using a CPA to do this. So this will give you a clean audit trail and will give you some easy accountability of where the money went. I think. So Stephanie, you want to take on the upcoming?
Yeah, thanks, Dalia. We do have a couple questions that are directly related to your presentation, so we'll go over them right now. The first question is, are you able to use EIDL for outstanding debt for the practice?
You can. There's no limitation to, PPP has a strict definition of what can be used for. EIDL can be used for other business debt. We looked at it for some other clients just from a standpoint that at 3.7% interest, if you have a high credit card debt, that might be an option for you to convert into a lower interest loan.
And then another question is, PPP is through your bank, but are there other loans through the bank that are available for you to use at this time?
Just the general commercial lending. So if you have a line of credit, if you have, it's just a general commercial lending that your bank might be able to assist you with. Again, the banks are going to be very, very skeptical on lending it now. I say to my clients all the time, go get your line of credit when you don't need it, because when you need it, you're not going to get it. So it's, for physician practices, it's a little bit easier. For dental physician clients of mine because of the industry, because of this the stability in the industry. So you may still be able to obtain, but I honestly, I asked my own bank if I can increase my line of credit just in case, and they said that probably going to be not a good time to do that.
Thank you, Dalia. As we mentioned earlier, we will make this presentation available to you afterwards via email. If you have specific questions that you want that weren't answered here, you're more than welcome to follow up directly with the presenters or respond to the email that you get regarding the presentation. And we have had several requests for other presentations to come up in regards to HR policies, legal considerations, marketing strategies, and commercial lending. So if there's additional items other than those that you'd like to see, please reach out to us on the contact information provided at the last slide and let us know. Otherwise, we really appreciate you. We hope that you stay healthy and safe and well with your families and your practices. And we hope you have a good day.